My name is Father Michael Bryant, and I was formerly staff chaplain at the District of Columbia Detention Facility full-time for 25 years. And for the last 10 years, we started a re-entry program in Washington, D.C. and Montgomery County and Prince George's County to help men and women who have been formerly incarcerated to transition home and to effectively reestablish themselves in the community. I'd like to talk to you just for a moment about the supposed drugs, the war on drugs in this country. It's been my experience in the long period of time I've been chaplain at the District Detention Center and have been connected with other national organizations around the country, that it was fatally flawed from its inception. Obviously, we don't want drugs all over our communities and people being drawn into the addictive environment of what heavy-duty drugs do to them. But we also remind ourselves that locking up people then who obviously are caught up into addictive behavior, incarceration is the last possible place you want to put people. And it's listed in the mental health directory that doctors and psychiatrists use around the country, that addiction is a mental illness. It's classified in that category, and it should be treated as a mental illness. Addictions, you can have all kinds of addictions, whether it's food addiction, you can be addicted to clothing, money, you can be addicted to alcohol, and for sure you can be addicted to drugs. And what I've seen happen in our society over the last 35 years now is that there's been rampant development of people who have been funneled into the criminal justice system in this nation by the being caught up into the drug experience. And most of the people that go into the prison system are not people of middle and upper class society. They're people from the poorer sections of the community and urban centers around the country for sure. And these people, oftentimes people of color, black and brown people, who are really trapped in the system because once they've come through the system initially, there's very little treatment that's given to them, and then they're turned back into the community. And we know that within 3 years of release, people with untreated addictions will be rearrested or be in violation of their parole requirements, and half of that number will be reincarcerated. Incarceration has only escalated over the last 35 years in this country. It's something like 800% across this nation. We have the highest incarceration rate of any nation in the world, as so many people understand now. And we're only 5% of the world's population, and yet we capture 25% of all the people on the planet right now who are in our jails and prisons in the United States. There's another 9 million people out on parole and probation as we speak. And that you put those numbers together with the other 2.5 million, you're talking about approximately 11 million people who are in some way under correctional control across the United States at this time. And most of those people are, what they have in common, black, brown, and white people, are the fact that they're coming from the poorest sections of the community, where they've had little in terms of advantages in their lives. Most of them have been born poorly, and when they've been born into poor environments, that means that their parenting experience is not good. Maybe mom or dad, or both mom and dad, have gone through the criminal justice system. Their educational experience is also bad. And many of them that I've encountered over my time as a staff chaplain are men and women that clearly have dropped out of school in 9th or 10th grade, and they end up then starting out in the juvenile justice system, and they advance to the adult system, where they will begin to come and go over the course of 20, 30, 40 years. When they come back into the community, 67% of them will fail to transition effectively. A waste of time and a waste of money for not only the individual, but also for this country, and the use of poorly used tax dollars. If you had a business and your business failed 67% of the time, you'd have to do something dramatically different or you would go into bankruptcy. There's the beginning now, just the very beginnings of a bipartisan effort on Capitol Hill to begin to change some of this mass incarceration that we're facing in this nation today. And remind ourselves that we need to support efforts to help people with addictive behavior to get into mental health treatment and drug treatment programs in the community. They do not need to be in high security environments. 67%, 65% of the people in our system today are nonviolent drug offenders in the United States. If you took 65% of the people out of the federal and state institutions as we speak, you would not have over-incarceration in this country. So I really hope and believe that if we begin to approach this matter in a much more sensible way, it's going to be good for the country, and obviously it's going to be good for the people that come in and out of our system. Thank you.